Hi, my name is Sandesh Subhash Bashwalkar. I am age 43 years. I live in Sanpada.
Myself, Dr. Atul Ingle. I'm a director of nephrology with the Fortis Group of Hospitals. I'm basically consultant nephrologist and transplant physician.
Since 2007, I was under medication, means as per the doctor medicines prescribed, and since then means I'm in continuous follow up with doctor. I went abroad for some certain assignments. My creatinine was increasing continuously, and that is something means was the major concern.
See, basically, Sandesh I know since 2007. When he came to my clinic, he was very young, detected to a hypertension because of his symptoms. He had a weakness, headaches, frequent. Then I was wondering, the young patient is having hypertension. Naturally, the most common cause is kidney involvement. So I started working out on finding out the etiology, means reason for his kidney involvement. I came to reach the diagnosis that it's a chronic kidney disease because there were scars, there was a protein loss in the urine, what we call it as albuminuria, and not only that, I did a biopsy, and biopsy has proven it's a membranoproliferative glomerulonephritis. Now, as everyone knows, CKD means basically aging of the kidney. So I explained Sandesh, see Sandesh, we have to take care of the 9 risk factors. We'll take care of it, and eventually time will let us know that when you will progress to end stage renal disease. You should consider it few years from now. But he was fit enough and he was taking good care, he was sincere, so he could go abroad, do his assignments, do his job, and we could literally pull him on for almost 14 years, 15 years. Recently, 1 year back, when it was just the COVID, his creatinine shot up about 10, and I was really worried because this is a time when he requires renal replacement therapy, that is dialysis or a kidney transplant. But considering his age, I thought of transplant because transplant always do better than maintenance dialysis, because dialysis works only 20% of the natural kidney. So option for me was to discuss with him, find out a proper suitable donor, and then go ahead with the transplant only. So we had a discussion. We discussed about the access for the dialysis. We decided that we'll go with the permanent or temporary catheter, but not go for fistula, because fistula is kind of a permanent construction. So we did put a temporary catheter, then shifted to a perm cath, right? Perm cath. Because some or other hurdles were always there, even though Sandesh and his family was very cooperative, there was no problem from their side. So I put him on maintenance dialysis in the beginning, because to stabilize him, to reduce his bring down his creatinine level, and then find a suitable donor. So his mother came forward. Mother, naturally any mother would do best for her son or daughter. So she was ready, she was very aggressive. She said, no, whatever happens, I am going to donate the kidney. I said, fair enough. But there was a problem with the blood group. Sandesh's blood group was B and hers is AB. So it's kind of a transplant, what we call it as a ABO incompatible transplant. So we had to prepare accordingly. Not only that, we had to prepare for the funds, take care of him. So we got him investigated in detail. Later on, we took up or followed the protocol which usually been followed for the ABO incompatible transplant. Unfortunately, Sandesh had some problem in the lungs. That was an infection with the Klebsiella, I think, which was confirmed by pulmonologists. So I put him on antibiotics for 1 month. So his transplant got delayed by 1 month. So after 1 month, we taken a proper steps and did ABO incompatible transplant successfully, as you can see from him now. And you know, ABO incompatible transplant is always on the left hand side, means it's a riskier job as compared to the routine transplant, because you had to have fear all the time about the rejection. But Mother Nature plays an important role. It was a mother who has given birth to Sandesh. So I was very confident that it is going to be a grand success. And as it has proven after the transplant, without any hitch, I think you were discharged within 6 days of transplant. and mother was discharged within 4 to 5 days of transplant. So that's a success story. I should rather proudly say. I am proud about Sandesh also because he did not let my word go down, single word. He followed each and every instructions properly right from 2007. It's almost 15 years. So I think that got benefited him in the form of transplant, because transplant is a very risky job where doctor's team and the patient and his relatives has to go move accordingly or side by side.
I was admitted on 13th of August and my surgery was scheduled on 17th. The transplant was scheduled on 17th. And I got discharged after 6 days, around 24th, 25th of August. Post that means, of course, means whether it's pre or post surgery, the isolation plays a very vital role in any transplant. So means since then, since discharge, I am under isolation, and since it's a ABOI case in my case, so I'll be under isolation for 3 months, and I'm doing the regular checkups, regular tests, and being in touch with doctor for that. Since transplant, in fact, I could feel the difference. Okay, earlier before transplant, I was not energetic kind of thing. Means I was feeling lethargic and all. But since transplant, even not only me, my family also says with you have become energetic now. So this is the difference which comes out of. I am feeling first time. Probably means this could be the result of the successful transplant, I may say.
As I said, I was worried about the incompatible transplant. But as I said, mother being a donor, I was damn confident it is going to be a success without very minimal hurdles. I did not take a chance. I forced him to undergo protocol biopsy also once because I had a fear whether he is going with a silent rejection kind of thing. But touch wood, grace of God, there was no rejection. And he's following sincerely, his creatine is coming down. You have to ultimately see the person who is a donor age, because she is almost 70 years. So naturally the kidney function is bound to be on the lower side, what we call it as a aging. And you can look at the Sandesh, he's 6 by 6. So his body surface area is much more bigger. Despite of that, her kidney is functioning quite well with the Sandesh. Creatine is hovering around 1.6, 1.7. There are no symptoms, no regrets, nothing. And he is overconfident. So I am allowing him, probably would allow him to join his duties, I think before 3 months only, most likely.
Personally, would like to express my gratitude towards Dr. Atul Ingle sir, because since last 15 years I am with him. Only thing is I would suggest you just go by the doctor's words. Okay, just believe them that they are the experts in their field, and just we have to blindly follow them. Means whichever doctor it could be, but we have to follow them and keep our attitude positive towards and be confident always. And that's the mantra we should follow actually. Right from the OPD, earlier I had to go through all this fitness test through the various doctor specialists. So from the OPD till the discharge, when I got a discharge from the rooms, the ICU, SICU, even for that matter, the dialysis centers, the staff and everybody, including the billing, the accounts and billing department team, everybody was very cooperative. It was a good experience for me. I made a few good contacts also in the hospital. I would recommend this hospital for anybody. And if anybody wants to get benefited by my experience, I'll be happy to help them.